Hello, I want to welcome everyone to the ASDP Dermatopathology Fellowship Forum. Thank you all for joining us. First, I'm going to introduce myself and both of my co-directors. I'm Tricia Missel. I am at the University of Florida. I'm both the Dermatopathology Division Director and the Fellowship Program Director there. Dr. Johnson?
I am Emma Johnson. I am a dermatologist and dermatopathologist at Mayo Clinic in Rochester, Minnesota, and I am also the fellowship program director.
Hi, I'm Jody Spicer. I am the Dermatopathology Fellowship Director and Director of Dermatopathology at Loyola University Medical Center.
Great. And we have some great panelists here tonight. First, we have two of our current program directors. Dr. Grew, did you want to start?
Sure. Hi, it's a pleasure to be here. I'm Alec Grew. I'm a professor of dermatology at Columbia University, and I'm the director of the newly established Dermatopathology Fellowship Program there.
Hi, I'm Emily Chu. I'm a dermatologist and dermatopathologist at the University of Pennsylvania in Philadelphia, and I'm also the fellowship program director.
Great. Right, we have two new faculty, recently graduated fellows. Dr. Mark Dan.
Yes, hi, I'm Janina. I'm a first-year dermatopathologist at the Lebanon VA Medical Center. I'm PATH trained, and I did my fellowship at Penn State.
I'm Victor Kwan. I'm a first-year dermatologist and dermatopathologist at Northwestern University in Chicago. Also an associate program director for our residency.
And we have two current fellows joining us also. Dr. Who?
Hi guys, my name is Jeff. I'm currently the Dermpath Fellow right now at Oregon Health and Science University, and I have a dermatology background, so I did my residency in dermatology.
And hi everyone, I'm Christina. I graduated derm residency from Temple in Philadelphia, and I'm the current Dermpath Fellow at UF with Dr. Missel.
Great. All right, so just to give a brief overview of types of questions we're going to go over. First, we're going to go over program requirements for ACGME accredited fellowships, the application process and the selection process, as well as that timeline, how to approach interviews, both in person and virtual, and then, some perspectives of these wonderful panelists that you just were introduced to, our program directors, current fellows, and recent graduates. All right, so I'm gonna stop this so you can see our panelists a little better. And I'm gonna start with some of these ACGME program requirements. So maybe our program directors are gonna be the ones with the best answers here. But just to start, how long are dermatopathology fellowship programs generally, and what accounts for any variation?
So I'll start. So typically, I think most fellowship programs are about a year long. Occasionally, there are programs that are about 2 years long. The programs are tailored such that if you are pathology trained, you will be getting extra dermatology education during that period of time. And then if you're dermatology trained, you'll be getting some extra pathology training. And the particulars may be up there, but we can go over that too, if that's helpful. And then, things that can extend training, I think it varies from place to place. At our program, we have the option of having an extra year of research training, so that can be built into the program, but it's not mandatory.
Great. So as you kind of touched on, what are the main requirements that fellows must fulfill? And then if you can touch on how that differs between PATH and derm trained fellows.
Absolutely. So for the fellows, they need to have a dedicated period of 4 months of devoted dermatopathology education during a 1-year period. And then for the pathology trained folks, then you would have to spend about 50% of the next 8 months or the other 8 months of the year seeing patients. So it's expected that you would see at least 500 patients. They can be children or adults. For the dermatology trained people, then you would spend, again, 4 months in dedicated dermatopathology education. And then the remaining 8 months would be split. So about 50% of that time would be in some type of surgical pathology education. And the expectation is for approximately 500 cases or more of surgical pathology. And then generally speaking, programs are allowed to have fellows basically if the fellows are going to see at least, I think, 5,000 accessions a year.
That's about all that I know for the specific requirements. That's it in a nutshell. Anything you wanted to add, Dr. Grew?
Yeah, I think one of the things that has changed over the last years was to relax the number of specimens or the number of patients that each trainee has to have, which at one point was sort of stressful for the people because there was, for patients in particular, it was like 1,000 patients that you have to see. And this way, I think people have more time during training to sort of really focus on the clinical encounter or learning about their case in the pathology environment, and has made the program directors also have an easier, mind trying to make sure that their fellows were completing the requirements that were needed. But I mean, I think Emily covered the vast majority of the needs. I think a lot of programs have major differences in terms of how the clinic and the pathology time is scheduled. I think a lot of programs are from the pathology trained people, many are very heavy on having a fellow shadow clinicians or residents or attendings. And some other programs do have a requirement where the fellow will see the patients independently, will formulate notes, etc. And so anyway.
Yeah, and so those were some recent program changes from the last time the ACGME opened up for program changes for the subspecialty specifically of dermatopathology. And we do have on the ASDP a formal committee of program directors. And so we were definitely all instrumental working together on those changes and how it could really influence and better our fellowship programs. So thanks for mentioning that. And then, one of the questions is, are there any anticipated upcoming changes to the ACGME program requirements?
As far as I know, after these most recent changes, I don't think there's been any talks to change further. But yeah, just to echo what was said by the previous two program directors, I think it gives such a better quality to the education by reducing the numbers. So we're not just checking boxes, but our fellows are actually learning.
Yeah, and so the ACGME, the program requirement are going to be open for our dermatology program soon, but not for dermatopathology. So no changes are seen in the near future. So what are the main goals of dermatopathology training? I'll open that up to anyone.
I mean, I think the main goals at the end of the day is to put out clinicians and providers that have a sound base in both dermatology and pathology. We really try to focus, you can't really do derm path without having a sound base in dermatology as well as a sound base in pathology. So I think we really strive to get an understanding of both of those two so that you can then merge it into your derm path knowledge. Also to establish people out in the derm path field that are going to be leaders in terms of research and education. I think that's very important. So yeah, that's how I would summarize that.
Great. And then maybe for either our current fellows or recently graduated fellows, how are you generally involved in either teaching or research during your fellowship?
I can take this one. I think we have a really great program in terms of having the fellows be integrated with teaching, having residents rotating on every month. You get one-on-one time with them when you're just going over slides. And then we also have a more formal didactic curriculum where we go over chapters of Elston. So we're able to have like a more structured kind of lecture series for the residents. And I really enjoy that. I really enjoy working with everyone.
I can comment on research, because I feel like I benefit a lot from having really great mentors here at Northwestern, where I got time and a lot of flexibility. You know, we have different experts in different areas, like Dr. Guittart focuses on cutaneous lymphomas, Dr. Garami focuses on pigmented lesions, Dr. Nguyen more medical derm, and you know, as fellows, our fellows definitely get a chance to work with any of them. They always have projects available, even from pretty much the day you start, and they really encourage you to be involved with the ASDP, submit abstracts, work on papers. And they also gave me time because my interest is actually in hair disorders, at least for research. So they gave me time to work on establishing IRBs for the clinic and for our DermPath repository. So I'm able to kind of get a head start now that I'm out in practice.
Great. Anyone else have something slightly different?
I don't have really that much to add in terms of I can speak to the kind of the education portion of it. I'll say it's very similar to us where when you're on the derm path rotation, there's usually a pathology residents, medical students, or derm path or dermatology residents who are probably rotating. And so there are a lot of one-on-one times during kind of before when they're previewing cases and then actually at sign out too. And then as the derm path fellow too, you're also involved in terms of the more formal didactic curriculums as well. And so that can be Elston and or chapters that we march through as well. And then we'll just do kind of topic-based ones based off that.
Yeah, I think for me, I just felt like I was kind of the go-to person for the dermatology residents if they needed slides for research, for me to take pictures for projects that they had, for grand rounds. So I think it's like a cool in-between role that you kind of take on.
Great. All right, well, I'll hand it over to Dr. Johnson to continue some of the discussion.
Sure. So the next topic we're going to touch on is the application and selection process. And some of you may know that the program directors have really put in a valiant effort to get us all on the match system, but have not yet succeeded. So for the current application season, which is 2027 to 2028, there is no match for the DermPath Fellowship. There is also no unified timeline, which we have used in the past. In the past, we have sort of, as ASDP program directors, agreed to all march along the same timeline, but we decided not to do that this year. So in general, applications open 24 months or 2 years before the matriculation date, and each program will have a slightly different timeline. After reviewing applications, interviews are generally offered on a rolling basis, and then the actual spot can be offered at any time. The ASDP is really wonderful and has put together a spreadsheet for all of the program directors to input their timeline or their outline for how they plan to do this application season, and it is updated weekly. So check there for any sort of information about positions that are open or already filled, or when they'll be looking at applications. We have also tried to get on a unified application service, similar to ERAS, but we don't have that. So each program will have a slightly different application. We do recognize that this is laborious for everyone, so we are very much trying and will continue to try to eventually get on a unified application and also a match, but unfortunately not for the 2027 application. So the best thing to do is just check the ASDP website for further information about each program. So what are we looking for in an applicant? Dr. Chu, Dr. Grew.
Well, I'll just start by saying we're always interested in people who just love learning, who love dermatology and dermatopathology and pathology. who are interested in hopefully advancing our field and being really outstanding diagnosticians, and who are just fun to work with. I mean, that doesn't hurt. We spend a lot of time with each other around the microscope too. So I think having it's such a pleasure in Dermpath to be able to work with wonderful colleagues.
Yeah, I was
sorry,
going
go
to
ahead.
echo what Emily said. That is really important to have daily fun with the people that you're working with, and having intellectual curiosity, not from the standpoint of research, but really people who are eager to learn and eager to be involved, that are motivated, that really wanted to participate and make it into a dialogue when you're working together. It's such an important year where one of the things that I have been, that I've noticed through my years involved in education is that it's really not just about sitting on the sign out or previewing cases, etc., but it's a very important year of education for yourself and educating your peers, your residents that you work with. So I will say, for most of the programs that I know, the education aspect is such a critical part of the training that you are really looking for someone who is very motivated to teach. And so I think that's something that we emphasize. And of course, someone who wants to model on interdisciplinary conferences, that there are many, and have fun. So
I think, to me, one of the most important attributes that I look for is coachability. Not only is it important in Dermpath and working with myself, but I think just in life, to be able to take feedback, be able to process it, be open to it, and change based on that feedback without being defensive. And I think you just learn more. So for me, coachability is a huge, huge attribute that I look at. I also think that I do second 100% being passionate about what you do, because I think, at least for myself, I feel so very lucky to be in this specialty, and I absolutely love it. So I would like to see that same passion. But also, I think this is a year for fellows to really act like they are practicing. So taking responsibility of the service as if it were their own. So me not having to follow up, them taking the opportunity on a really tough case to go to the literature and find what you think is the answer. So I really try to, especially if you come from the path side, there seems to be this deferral to being someone's secretary, getting the report in, writing the right answer. But I really want you to dive in and be a clinician and take on the responsibility of the fellowship as if it were your own cases.
I completely agree with all of those. I also think that, like Dr. Grew said, we are going to sit with these our fellows, every day side by side. So having someone that is easy to work with, easy to communicate with, is really important. And I think attention to detail is also really important in our specialty. Everything is getting a lot more complicated with molecular and immunohistochemical stains. So attention to detail is really something I look for as well. Anything else, Dr. Missel? One of our questions that we get often is, are applicants expected to do away rotations or observerships? I'll just start by saying at Mayo, we do not have away rotations or observerships. So I do get requests for those quite often, but the answer is always no, because we just don't have that as an option. And I think that speaks to us. We do not expect people to have done that or do that. And that is why we don't offer them.
I agree. Oh, yeah. I think, I agree. I was going to say that we can technically have people come to observe or rotate, but it is very challenging. And I think that's true at a lot of programs now, is our, our graduate medical education office is sort of inundated by requests for people to come rotate for many, many different specialties. And as a result, it's created a lot of paperwork. And it's not a very fun or satisfying answer, because personally, I think it's great to be able to work, in other places and see what it's like at a different institution. But, the reality is, I think it's increasingly difficult. And so sometimes, people do contact us asking if they can come rotate, and often we say no, even though it's not 100% no. We just don't offer certain persons. It is just challenging to make it happen, and so there are only a very certain circumstances where that could actually happen. So I don't want people to be offended if they hear that we can't actually take them for some reason. But it's absolutely not an expectation.
And as you mentioned, it is great to be able to work with people. And I think that the ASDP Mentorship Award is a really great way to get connected to people from a different institution. And we have had candidates who we've met through that. And on another point, meeting people at meetings, I do actually remember people at the meetings, and when I'm reviewing their applications, I'm like, oh yeah, they gave that great talk about XYZ. And so that really does, I think, help. I have a question here that's from the Q&A. One of our attendees is asking, do we get applications from people we've never met or heard of or heard from?
All the time.
I would say probably 90% of the applications are people that are not from our institution or anything like that.
I think it's actually kind of fun to see applications from people that you've never met before, because I understand why people want to have their names out there already, but frankly, it's always kind of a fun surprise when you read an application and you've never actually heard of that person before, and you can learn a lot, and we certainly do, and we have definitely taken plenty of applicants who were not necessarily on our radar before.
If I could just add on to Dr. Johnson's comment about remembering presentations at ASDP. I've actually had several people come up and introduce themselves at ASDP. And it's interesting, but you do remember those names, you do remember those faces. And so when their application comes through, there is some recognition there. So, don't be afraid to come up and introduce yourself.
I have another question from the chat that says, or that's asking, are applicants coming straight from residency viewed more favorably as opposed to graduating and practicing either dermatology or pathology for a few years and then returning to fellowship?
Personally, I don't think we really, there are so many different ways to think about our applicants. I think just categorizing them versus in whether they came directly from residency or not is not the biggest factor on my mind. We've had great fellows who came right from residency. We've had great fellows who took some time and had perspective from being in practice, and I think that's really valuable too.
I agree. And honestly, because the application is so early, I often will give people, the benefit of the doubt that it took more than 2 months of residency to find that you're interested in DermPath. So I think it gives people a really good perspective when they've done a year of clinic or path outside of fellowship.
And I think it's also, quality, not quantity on your curriculum vitae. I think, even if you're straight out of residency, what have you done with those 4 years, in terms of leadership or political action? Yes, I think that there's something to be said for going outside and working. I think I have a lot of respect for that as well. But, they're different experiences that are both can really add to your education. So I don't favor one or the other. So again, really focus on quality of things that you're either passionate about or that can contribute over just having a bunch of bullet points.
I agree. And what advice would we have for anyone reapplying or having not been successful the first time around?
So not to talk too much, I guess I can take a shot at this. My one thing is to make sure that your application is different than your application last time. So make sure that there are, significant changes in terms of leadership positions, in terms of advocacy, in terms of teaching, or in terms of research, or, ideally all of the above. And then make sure in your letter that you point those changes out. And brag in a very humble way, because it is a big deal. If you've truly gone back to the grindstone and made your CV stronger, it's something that you should be proud of, but make sure that we know which changes you have made in your letter.
I completely agree with that. It's always, I think a lot of times, with the application, especially if we don't know you already, then the application is your chance to tell the story about, what's happened and what you've grown from and what you've learned from. And so that's incredibly important to detail in it. We don't want to see an application that looks exactly the same as what it was, the last time you applied.
I was going to add something else that was mentioned before, but just to emphasize the mentorship program that the American Society has offered. And this is a program that has been available for many, many years. And it is truly a unique mentorship, time, commitment, and that really allows for a very close interaction between the mentor and the mentee. And it, from what I recall, from what used to be, and I hope it's still the same, it does have a requirement to spend a dedicated time at the outside place. So meaning that you will go and rotate for an X number of weeks with the person, with your mentor. And it does offer, for the people who are awarded, it's a very strong program that has really fostered many strong and successful relationships. And while I don't have the data to support, I will say that it is very likely that most of the people who are awarded mentorship programs enter a DermPath fellowship, and are successful in their career. So I really wanted to applaud the ASDP because it's been a program that has been available for many, many years, and people have been extremely satisfied. And so anyway.
And I have an interesting question from the chat. What are some critical pitfalls you see on otherwise strong applications?
I'm trying to think of some examples from specifically dermatopathology applications. I also read a lot of applications for our medical school and for the residency program. But again, I think a lot of times the application is really your chance to tell the story about yourself and why you're interested in a certain field, and in this case, dermatopathology. If some things that come up are if something in the story doesn't make sense. For instance, if you were a dermatology applicant and everything that you had published, say you published 20 papers that were all on Mohs surgery, then that might be a little bit of a concern, unless you explained it somewhere in your story, about why that was the case. You had to, you really like the DermPath aspect of Mohs and you change your mind later on. But, I think there are some potential questions if, I'm not saying everything has to be completely consistent because we're human and not everything is consistent in life. But if it seemed like your trajectory is in one direction and you pivoted, that's something that would be good to explain in an application.
I think that it's important to review and update your social media accounts to the level of professionalism that you want to reach. I don't personally go on and look at people's social media accounts. However, we have several people involved in our application process, and some people have been known to do that. So, be careful what you post, make it professional. If you need a personal one, make it private so that people can't see it. So be careful of social media. And I think the other thing is Derm and Path are relatively small worlds. And so if at any point I hear that, yes, they're amazing on their Derm Path rotation, they show up, but then, on Heme Path, they're kind of like, not really trying that hard, or in Surge Path. So, again, we want people who are excited to learn, who are excited to be well-rounded clinicians. So, you learn from every single rotation, whether it's heme path, whether it's peds derm. So be passionate about everything that you do. Everything will contribute in the end to the clinician that you are. So hearing anything about like, yeah, they're a superstar on path, but then not so much otherwise. So those are the two things that I would say.
And maybe a question for the current and recent grads. What should you look for when you're starting the application process? And what should you look for in programs?
I can start. I can answer this, or how I kind of approached it. I mean, it's coming from the path side, it's a very competitive process. And of course, you want to like keep your options as open as possible. So for me, I knew that I wasn't as interested in research, so I eliminated anything that was mandatory 2 years. And then I think it's just important to kind of be organized, have your spreadsheets, think about places where you'd be okay living for a year. I was very flexible, but I know some of my co-residents that were applying had only a couple of locations they were willing to go to. So I think that kind of helps narrow it down. But I think, yeah, just think about where you'd be able to spend a year training. And I think all of the fellowship programs will give you the exposure that you need. And, you can become a great derm path at any of them.
I also think now being in fellowship, something that's important is also kind of knowing what volume that you'll be getting at a program and what types of slides you'll be exposed to. So like, for example, at UF, we're lucky because we get to look at like consult sites from the hospital. We get a lot of community cases and also really interesting cases from our clinic biopsies. So kind of knowing like where your cases come from and how much you're able to see is also really important.
Kind of to add to that, coming from the derm side of things too, one of the things that I probably didn't think as much about when I came in was thinking about how some of the path rotations would be structured, and probably vice versa for the pathology residents who are going into derm path as well, how some of the clinics are scheduled too, and what you're going to be exposed to. So a lot of places do it. It seems pretty variable or different in terms of like how things are structured. But just like knowing about like, if the pathology departments, like if you are going to be rotating in heme path, are you going to be seeing also like consult cases? Is it just, are you going to be stuck on the bone marrow service where things may not be as relevant to dermatology? So kind of getting those information will be pretty helpful. And then another thing that was mentioned before is that dermatology is kind of getting more complex as things going on. So any exposure to kind of more difficult cases like molecular or things like that can also be an added bonus too. So something to think about if you will be getting exposure to those kind of things.
I'll add, oh, sorry, you can go ahead.
Go ahead.
Well, I was going to add, I mean, this is what I tell med students who apply to derm residency too, is that, you get a choice in terms of fit and culture too. So finding out about that and seeing how you, mesh with personalities. I think there's some empowerment to the applicant too. For example, I mean, our program, we have a really high volume program. And so like, you don't necessarily get to work up every single case yourself because, our service is really, really busy, but you do end up seeing pretty much every case at some point. And there's just a lot of a lot of independence in our learning style because of that. And so, I definitely spent time outside of the work hours, just being able to look through these complex consult cases, looking at molecular cases. But if you're someone who wants more of a structured environment, then a program like Northwestern may not, be the best fit for you. And you may want something that's more structured, where every day the schedule is the same. But for someone like me, it worked out really well.
And how do people find out about these different aspects of the program?
Yes, part of my interview process, I say that you're also interviewing me and the program, and I really want to make sure that you understand what's here because we all want a good fit. So obviously when you're deciding where to apply, I guess you have to ask around. But
I agree. We usually try to give an introduction about the structure of our rotations, and we can get as granular as you're interested in, on the actual interview day. But I think before that, it's a lot of word of mouth.
Mm-hmm.
Yeah, I think it comes down to networking. ASDP does have that Friday night. I forgot what the exact title is, but it's like a cocktail hour for people who are interested in current fellows. And those are things that really should be highly utilized. You can meet people, you can talk to the current fellows or other residents that have rotated there or future fellows there. And I always tell residents that I talk to that want to go into DermPath, although technically the other people applying are your quote unquote competitors or could be seen that way, they are such a valuable resource. I was so lucky to meet a group of people who were all interested in DermPath fellowships in Chicago, and we've all remained in Chicago. We do a journal club together. And they've been, the first and second year out, we would, look at cases together and support each other. So not only for the year of, applying for a fellowship is stressful. So it's nice to have people that know what you're going through and to talk to you about it. But then also for the future, these are people that, can be very good connections for you.
I agree. One of our panelists has asked, what does the panel feel is the most / possible amount of cases for a fellow can or should see in a year? I think that's a hard question. We've been asked that recently, and I think it can vary based on the case mix. If you're seeing a lot of consult cases and complex cases, I think that volume is going to be significantly lower. I mean, basal cells take us all just a few seconds to read out versus a complex molecular case on a pigmented lesion or in heme path. Those take significantly more time. So although people look for specific numbers in volume, I think it's sort of the case mix. And I would say if you're going to the fellowship, that fellowship has enough cases to become a fellowship. You will not be wanting to see, you're not going to be like, oh, I wish I had some more cases lying around. At least that's for in our case. So it'd be interesting to see or hear what others have to say.
Just wanted to say that there's a difference between, seeing a case that you didn't preview that just passes across the scope versus seeing one of those more complex cases and really spending your time on it and working it up. So I think you'll have enough cases in your fellowship, and it's kind of up to you to decide like how much time and effort you put into the more challenging ones.
I was going to say, so just following up on what Dr. Johnson mentioned, and I think the case mix is really critical. It's not the number of cases. You could be seeing, 100 benign nevi in a day, and you go through them and you don't feel like you've done much. And then you get a day where you have 20 tough inflammatory disorders or hematopoietic things, and then your day goes really wrong despite you only had handful of the others. So I think coming on board and being motivated to learn from the difficult cases is really the critical time to do it. Because once you go out and practice, and especially a lot of the people who go out and finish their fellowship are going to go to private practice, you won't have the chance to see them that often or learn from them that often. So take as much time as you possibly can to learn about all those difficult cases. Enjoy the benefits of, the daily consensus conferences where people show their tough cases, learn from that, learn from the differences in opinions you hear from different people. Everyone does, as you know, things in dermpath a little bit different, and it's sort of an art in a lot of sense, as it is for many other disciplines, but it's so much more, I think, in dermpath in some areas that just learning how people approach the cases and the difficult ones is really, really important, despite perhaps not seeing 150 or 200 cases. That's not the purpose of that. It's quality, not quantity.
I agree completely. So I will pass the floor to Jody in how approaching interviews and also then perspectives from our current fellows and recent grads.
All right, so let's talk about the exciting stuff, the interviews. So the first thing I wanted to say just in general, and I say this to all the derm residents that I interview as well, take the time to appreciate all that you've done up until this point. If you are on this webinar, if you are applying, I very rarely see a CV that is not impressive past my desk. So you guys need to give yourself some credit. You need to have confidence in what you've done. You need to be proud of what you've done this far. And I just feel that sometimes the interview process can feel so very one-sided, but realize that any program that gets you is lucky to get you too. And then again, I think it was Dr. Johnson that said, it's really a two-way street. Like, you're interviewing us as much as we're interviewing you, because there are very different cultures at different institutions. We are a very informal culture, maybe to a default at Loyola, different levels of responsibility, how many people are in the room. So it really, if you're interviewing and we're interviewing you, we really do want to know that you want to be with us, because it's a year-long thing, right? So it really is a two-way street. So let's start with this. What does an interview day generally look like for applicants? And maybe the future recently graduated fellows, because you're a little bit closer to remembering your interview, if you guys want to take this.
I guess I can start. I feel like it's also feels like a long time ago now at this point, but in terms of kind of how the interview day went, I would say it's kind of highly variable depending on kind of which program you're interviewing. So some programs, it will be like basically like you will interview with everyone who's on faculty as like individual one-on-one throughout the day. I've had one where it was basically kind of just a group panel and everyone was in the same room as well. And then I've also had instances where you would meet with like the fellow just to kind of talk about the program. And so that would also be a good time to also learn as much as you can about kind of how the fellow feels about it, things that he's experiencing or she is experiencing, and kind of like, the curriculum, didactics, any of the granularities that you want to know. But it was highly variable for me. I don't think any one interview was actually the same format.
Yeah, and I think I experienced something pretty similar. So a lot of my interviews are actually, I think all of them were Zoom. So I didn't actually visit anywhere in person, and they were fairly informal. Typically, you really want to try to get to know the program, ask a few questions, and then you get to talk to the current fellow, as well as the program director and other attendings who work there. So it was a nice mix.
So another question that struck terror in the hearts of all applicants And I think that it's probably a thing of the past now that we're doing a lot of virtual interviews. Does anyone ask medical knowledge questions while people are interviewing? Back when we were doing it in person, there was always the possibility, are they going to give me a quiz? When I'm sitting at the scope, are they going to ask me a question? I don't know if you sit in on virtual signouts at all during interviews. So that would be a good question. We have certainly done Teams or Zoom signouts, which might be another option also if you wanted to get to know programs. But then also, do you ever ask applicants, medical knowledge questions?
I will start by saying we don't typically ask specific medical questions, neither now nor when we used to do in person. Although if we do interview someone for a faculty position, we will do that. But I never saw that as a really something that was kind of relevant to the process. And you just don't have much time. So I feel like unless you really have a significant amount of time with a candidate, which is not the way that the interviews these days operate, I just don't see that as being something that will make me decide about that person differently or not.
Yeah, and again, it might have just been an old wives' tale at the time, but there was a lot of chatter about it. So just to clear that up for everyone, take a deep breath. So this is actually my favorite question, and I actually always struggle with this as well. What are good examples of questions applicants should be prepared to answer? And also, what are good example of questions that they can ask?
I would start by saying you should be prepared to explain why you like DermPath and why you're interested in pursuing a career in DermPath. It sounds very obvious, but it's the obvious questions that sometimes trip people up. And so being able to describe sort of your path to DermPath and how you've become interested and want to pursue it further, although as an obvious question is something we do ask people. And then for the candidates themselves, asking things that show that you've done a little bit of research or thought about the program a little bit are helpful. So knowing who is path trained versus derm trained, and will you get exposure to both of those people? Things that have demonstrated that you have done just a little bit of research about the program and why you would be interested in it are helpful.
I agree completely. And I think it's your chance to also, of course, learn more about the program, about the faculty. I think we sometimes take it for granted that we have these amazing people around, but it's always, I think, fun to be able to ask people what brought them also into the field and what keeps them there too. And it'll, again, these are people who are going to be working with for many years to come.
I guess changes. I think that's always a good question if, especially when we are interviewing a couple of years prior to you coming in. Some changes aren't even, we don't know are going to happen in the next 2 years, but for applicants to ask about the program, any changes so that they at least know.
For any of the current and just recently graduated fellows, did you guys have any favorite questions, maybe questions that you got the most information out of, or maybe something outside of the box that we haven't thought of in the bullet point list of good questions to ask during interviews?
I think ask the fellows everything. Like I think one of my questions was always like, run me through your typical day and week. Like, what time do you come in? What do you do exactly? And I think that kind of gave me the best idea of the fellowship. And especially because when you're interviewing, they're pretty fresh. The fellows had just started a few weeks ago. So you're kind of really seeing them in the toughest time of the fellowship.
I think one of the questions that I think I would like to ask is kind of, has there been a time where the program has made basically changes based on previous fellows' kind of experience. And I think you get a lot of information based off kind of the willingness of the culture to kind of make those changes for people. And so that's just a question that I usually kind of ask.
It's a great question. It looks like we're right at about 7:50. So yeah, and just to sort of add to taking some interest in the people that you're interviewing with in the programs, it actually can be pretty beneficial to you to find commonalities. So I went to University of Wisconsin. I love meeting fellow Badgers, or just, her interests are blah, blah, blah in research, So I've actually been cited to myself, and that's pretty cool. It means I'm a huge nerd and I love it. So it can be very beneficial to you as well to find commonality, either with the program directors or with the fellows. Do you guys want me to do one more question, or do we want to leave the last, 10 minutes or so to general questions?
You can do one more.
Okay. So I really like this one too. How do you get the most out of your fellowship year? Because it's so short, you guys. You start and you finish and you're gone. So yeah, I think that's a really, really good question.
I think being present
Sorry. Go
is
ahead.
incredibly helpful. Oh, sorry. I'm gonna let Dr. Missel talk instead.
Oh no, I just said, it is so short. And so I usually start the fellowship with, you're not going to believe how quick this year goes, and so like hit the ground running, let's just get started kind of thing. So go ahead, Dr. Chu.
Sorry, I was just going to say, I think, yeah, being just be present and, take advantage of the opportunities that are there. It's a lot of things that have been said already, but taking the time to go talk to lots of people about cases, because you can see the spectrum of opinions, reading a lot about your cases, looking at, especially if you're pathology trained, looking at the clinical presentations, trying to do a lot of the correlation and take advantage of the expertise around and the resources around.
Is there anything the fellows would have done differently during their fellowship?
I think to Dr. Shu's point, I wish I had started reading textbooks earlier on in fellowship. I mean, because I think I really accelerated my learning once I decided that I was going to make, every day after sign, I'll just make like a list of questions or topics or diagnoses that I just needed to learn more about, just a to-do list. And then reading these older textbooks, even like Ackerman's old books, or even the newer ones that are just in each niche, I felt like that was so, because in residency it's so hard to learn actually what things are and to have your own opinions. It was more just, it felt like pattern recognition about, what's in Elston, what the testable material is. But as a practicing dermatopathologist, I feel like, we really have to understand why we're doing things, what we're seeing. And I think even having that kind of historical context, you get such a better understanding of how people talk about cases and just where those things can fit in your mind. So again, to the point of dermpath being an art. So like having all that context, I think really, really helped out a lot. Because otherwise, being present at the table of consensus, you just don't, everything's over your head and you're not getting as much out of it.
Very valid. Any other fellows want to contribute a last comment here?
I will kind of say that one of the things that I didn't realize coming from the derm side is how much dermpath is like a diagnostic field. And so communication is super important. And so I wish I paid more attention at the very beginning about like the slight differences about how my attendings worded things, even putting like the orders of the diagnosis, kind of framing it. And so just going back to those report and seeing, how they ended up, finally signing things out and just talking to them about why they didn't word it a certain way or another way, I think that will vastly improve kind of your knowledge and kind of what you will do probably as you are signing out as an independent practitioner too.
Yeah, and I totally second that. Kind of the wording on reports is definitely an art. And then now as I'm getting closer to graduating, kind of focusing on like, how would I approach a case that's maybe difficult, and really thinking through like the stepwise approach to something has been really valuable for me.
I think if and when you graduate, one of the most important things to know is actually what you do not know. So ask a lot of questions, understand what you're comfortable diagnosing, where you may have some weaknesses, and be honest with that. Because truly, as even now, 10 years out, I really truly believe that what I don't know, knowing that what I don't know and what I need to send out. So especially, your first year out. So don't be afraid to be vulnerable. Don't be afraid to not know things, because if you knew it all, I wouldn't have a job. So yeah, be vulnerable, ask questions, and know what you don't know coming out of fellowship and when you need to ask for help. Are there any other questions from the participants?
There's some questions in the chat. I was trying to go through some of them. There's a bunch that are really in regards to publications. Everybody wants to know if there's a minimum number that they need to apply. And so I think we all agree there's no minimum number, right? I don't think that's something that for DermPath Fellowship, I mean, being involved in research, great, but it's really about, your passion for DermPath and being able to answer that. There is one question that is specifically to the DermPath Fellows. What's something you wish you knew when you were applying that you now know? Is there one thing?
I wish I had done the mentorship program.
There you go. And it looks like Karen did put some information about the mentorship program to people who were asking about that. There's also a question about adding, is it easy to add a complement increase? I'm on the ACGME Dermatology Review Committee, and the timing is actually what's really important. So we only meet in January and April. So that would be, complement increases are typically approved in April. So you would have to really be in with a program and they would need to know that they need to apply for the complement increase. And usually that's not just one little form to the ACGME. Usually it goes through their chair and their department, whether there's funding or not. And then the GME has to approve for you to send it. Their institutional GME would have to approve to send it to the ACGME. I think, did you see any other ones in there, Emma, that?
Maybe we can end on, are there any underrated ways to learn about programs beside program websites or program social media? I think Dr. Spicer touched on that actually at the ASDP meetings. There's the Meet the Program Director that we put on, and then all of our current fellows are always there. And so hunting them down and asking them about programs. My future fellows are going to hate me to say that, but asking about the program, and also those social hours for new grads can also be really helpful too, asking, where did you go to fellowship? What was good about it? And so I do think the meeting is really a great place to network, and a helpful avenue.
I want to thank everyone for being here. If there's any last words you really want to tell those applicants, shout them out now. I hope everybody enjoyed all the questions, and if you can always reach out to the ASDP. There's a lot of information on the website, and keep reviewing it. Emma said it was going to be updated weekly from the program director's standpoint of when we've decided our interviews are, and any contact information is also on that spreadsheet of how to contact each program, whether it's the program coordinator or the program director. Thank you so much.
Thank you all. Thank you to our panelists for being here. We very much appreciate all of you.